This is the Neurosurgery Podcast.
Sing, O Muse, of the wrath of Achilles, son of Peleus, who brought destruction upon the Achaeans.
We used to play a game here in Miami where we asked people who they were. Hector, Priam, Agamemnon, Odysseus, Achilles, Patroclus.
Yeah.
So we finally arrived at my deadly sin, which is wrath.
Yeah.
Yeah. I put this up because the famous Halloween parties, we do a theme every year. This year was 2013, I think, and it was Marvel themed. And my wife and I did this, and I was the Hulk because that is the Marvel character that I am, which is unbridled passion, chaotic, and also semi-godlike, but also super wrathful and, problematic in that way.
Yes. And the way I conceived of anger, wrath, as opposed to patience, the corresponding virtue, was you are my enemy. That's what I think anger comes down to, is that you see another person and you treat them as foe rather than friend. Because if you define someone as an enemy, everything is wrong that they do.
Right.
But if someone is your friend, you can make 1,000 excuses for them, right? And so Carl Jung once said, we meet ourselves time and time again in 1,000 disguises along the path of life. And I think his insight there was that we're all, it's cliche these days even, we're all just people. We're all internally having identical experiences. We feel the same pain, we feel the same pleasure, we face the same wants and needs, drives and impulses throughout our day-to-day lives. We're all, in some way, whether you're religious and you think of a soul and a spirit, or you're psychological, you think about the ego, the identity, the conscious experience, we're all this same kind of internal thing in different bodies, walking different paths through this life. And when you're consumed by rage, again, you dissociate and you disconnect with that shared similar self in another person, and you view them as the other. And so there's a lot of different ways we can talk about anger. Anger at the world, anger at yourself. But again, this is the Neurosurgery Podcast.
Yeah.
And much like the long-suffering Amy Wang, who has to live with a neurosurgeon, we all have to live with other neurosurgeons too. And I think, at least me, in the throes of residency, probably the angriest I get in my day-to-day life on a regular basis is with my colleagues, with my coworkers. Anesthesia, those animals, right? But I mean everyone. The residents in the emergency room, anyone who consults us ever for anything, right? I'm still a resident, so when I get a consult, I Hulk out, right?
Yeah.
Still. And I'm working on that. But I think for people in residency, in a hospital-based environment, every day has 1,000, 100,000 opportunities to get mad at someone who is putatively on your team. And that includes our co-residents, right? My juniors, my seniors. I have one person the same year as me. But perhaps familiarity breeds contempt, and it's easiest to get angry with the people that you spend the most time with and around, and who you can tell yourself, oh, you should know better because you're one of us, right? But that's, of course, the resident take. Who do you get angry with the most often?
And this shit will get you canceled too.
Yeah.
Right? So this is my deadly sin.
Mm-hmm.
Right? At the risk of talking to thousands of people and saying, look, I'm the Hulk for a reason. So I think that it's mercurial, much like Achilles. It's whatever is in the way of progress. So the positive side of wrath, I'm going to turn this around a little bit. People say, well, it's an unacceptable thing to ever lose your temper, blah, 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 blah. But the reality it's like George Bernard Shaw said, right? There's the reasonable man, the unreasonable man, right?
Yeah.
The reasonable man conforms to the world. The unreasonable bends the world to him or
Right.
her. All progress rests on the unreasonable person.
Right.
So wrath is empowering because whereas we talked about lust last, lust doesn't really empower you. But wrath allows you to unleash what is needed to affect change. So positives and negatives, tons, right? So the negatives are the externalities of, non-collegial behavior, emotion, never acceptable, not in line with our standards or, whatever, culture, which I hate those comments. It's hard for me to even get it out of my mouth.
Yeah.
But the reality is this. We as neurosurgeons are trying to control the environment for our patients for better outcomes. There are very few tools at our disposal. So my plea is to say, look, I wish we didn't have to do that. I wish everybody just did their job, as you're saying, right?
Yeah.
Do your job.
Belichick.
That's right. But it doesn't work like that. So that's where wrath comes in.
Yeah. So, left turn. I love comedy. I love stand-up comedy. Big fan. And there's this phenomenon where there's two schools of thought. There's these two camps among stand-up comedians who, like neurosurgery, extraordinarily small community. There's I think under 100 comics on planet Earth right now who could fill an arena. It's an extraordinarily small community of someone who could fill an arena or even a large theater for stand-up comedy. There's a lot to mine there from a psychology or sociology perspective. But setting that aside, among them, I love these shows or podcasts where you listen to these people talk about comedy. Seinfeld's great with this because he has his Comedians Car show, great show. He's like the king of kings. But some comedians think there are bad crowds. Some comedians think there are no bad crowds, there's only a bad comic, right? And there's this dichotomy where they go, nope, I do the same show, I say the same jokes, and 20 nights in a row it kills, and then that crowd, they didn't have a good sense of humor. And then the other people say, no, it's you, it's always you, right? And tangent, why am I rambling about stand-up comedy? Because what do we always say? Oh, you're going to blame the patient?
Yeah.
And you know what? Some people bleed more.
Yeah.
Right? I've had a patient who went home and wrapped towels covered in dog piss and shit around his head and came back with a wound infection. You're going to blame the patient? We have people who don't go to rehab. We have people who don't take medications. And this is look out, medical Twitter. It's a dirty word, non-compliant with a prescription.
That's a dirty word.
You're not allowed to say non-compliant.
What's the new word?
I don't even know. It didn't conform.
Non-conforming?
Yeah, I don't know. But you're not supposed to say that because it blames the patient, right?
Okay.
But I think it's an extreme position, but it's probably good for people early in training. Extreme ownership, never blame the patient, because you're in an extreme setting because you're learning. And then later you develop nuance and wisdom. But again, you're talking about non-collegial behavior. I'm not talking about in my behavior, in my words, in my posture, my tone of voice. Assume that I maintain my professional demeanor. There are patients that piss me off every day. You meet a stranger in the emergency room, they have something wrong with them, you interact with them in a clinical setting as a professional. That doesn't mean there are people who are they're odious, they're dislikable, right? And there are people who make me angry, either because of, we have traumas. I took care of somebody who was a carjacker, who broke into the car of an older couple, with them in the car, sped off with it, trying to steal the car, drove it off the road. The older couple both died, and he had a spine fracture. And we took care of him because it's what we do. Fuck that guy. That's right. I was angry at him. We still took care of him, but I was angry at him. And whether it's a scenario like that where it seems like someone was doing evil but still came to us with illness to treat, or just someone who didn't do what you told them and so didn't get a good outcome, it's easy to get angry with patients.
But you always provide the best care.
You always provide
Right.
the best care.
So you have to contain your wrath,
Yes.
right? So I would suggest
This is
that,
like a therapy session.
I would suggest it's
But
like
yeah,
a-
talk to me. How do
it's
you...
nuclear fusion. You have
Yeah.
to bottle it up, and
Uh-huh.
you have to use it in the right direction. Now, I'm not saying I do it always right, but look, the reality is this. Our lives are so difficult. These scenarios you just discussed, like, nobody talks about it. Like, okay,
But that's real.
I'll one-up you on that.
It's well, please do and one up me, but I also want to hear about it in clinic.
Okay.
Because you're like the clinic Jedi.
I'm going to
master.
tell you right now. Okay?
Yeah.
I'll tell you a story very similar to that one.
Yeah.
Another automobile involvement. 2021 January.
Okay.
Okay, this is the vaccine release time.
Oh.
Somebody who got in a fight, a patient, spit on a woman who was pregnant with knowing that she had positive COVID. Now, I don't really care about the COVID thing, but like, this is in 2021. She had COVID, was positive, spit on a pregnant woman.
Hoping to infect.
Yes.
Oh my God.
And the pregnant woman got in a car and ran her over, fractured her spine. Now, okay, your brother Michael would go crazy with the legalities of like,
Yeah.
what does that mean? Like, who's really trying to kill the other person?
Self-defense. Yeah.
Yeah, right. There's too
Right.
many layers here. Okay.
Right.
So we as doctors have to step back, and we have to say, okay, well, like Achilles. Achilles didn't just wantonly kill random people for fun,
Right.
but he was mercurial and difficult to deal with, always. So can I turn it back on you then?
Yeah.
If not Achilles, who are you? I'm thinking more Odysseus,
Well,
personally.
that's what I was.
I do think you're more Odysseus.
You said that to me once when we went through this,
Yeah.
which at the time, it's easy to take that as
He
an
gets
insult.
Achilles killed
He does.
because for the better good.
Yeah.
Yeah.
Which I would never do.
No. But it was for the right reason.
Right. He's kind of a bastard. He's kind of wily, you know? He doesn't fight fair.
But why fight fair if you're going to die? Right?
Well-
So wrath has that peace, like lust.
Yeah.
Like wrath has that peace, like you're not actually behaving rationally anymore. Like, yeah, every time I raise my voice, which is once a week, was it in my best interest to really do that? No.
Yeah.
But the reality is it accomplished the goal.
Yeah.
That's Amy's parrot down there, sorry. It accomplished the goal.
Right.
And wrath, just like lust, has that time-limited peace.
Yeah.
Nobody's constantly in wrath. So wrath is compartmentalized that way. So how does one best utilize that to advantage?
Yeah, I mean, there's a classic piece of advice in relationship psychology and couples counseling that if you're getting in a fight with your spouse or your partner or what have you, just go into another room and wait an hour, because the half-life of cortisol and adrenaline, you're in a heightened state, and it's if you just leave and let it work its way out of your system, you're literally in a state of activation, and then if you just walk away and let it pass, then you can come and try to actually talk. Similarly, I'm feeling very wrathful towards that parrot right now, but I'm going to sit here and I'm not going to march down there and deep fry it. I'm going to sit here and let it pass and let it pass. But even even as Amy has many animals, we're at Amy's bar.
No working during drinking hours.
But even as we sit here talking about this, I made some notes and I had a plan for the different facets of these sins to talk about in our lives. And I wrote these notes months ago. And yet today, we were talking about, as we record this, we were talking about the Doobie Gooby,
Yeah.
the Dr. Gooby video.
Yeah.
And part of the dissatisfaction he expressed with his walking away from it all was with the system he found himself in.
That's right.
That it was financially motivated,
Mhm.
that he was feeling pressured to do things that he didn't think were right or helping people because they generate money for the hospital. And that other kind of anger that especially young people feel is anger against the system
Yeah.
and the man,
Yeah.
right? Which is in some ways easy and also difficult to do anything with for the same reason, in that it's not real. You're feeling anger against this abstract, ill-defined entity that you slap a label on, but it's not, if I'm mad at you, I'm mad at you.
Right.
And we can sort it out. If I'm mad at Joe Schmo, I can destroy him. We can come to terms and I can forgive him. There's an individual there. But this rage that so many people feel at the system, at the world that we live in, the reality of limited resources, I don't know how you overcome that anger, because in some sense, you're raging at the world and the facts of reality and nature that we live in. And in another sense, the system, the healthcare system is so corrupt. What is the healthcare system? And you're someone who, I marvel at the way that you navigate systems. I'm terrible at it. That's why I always laugh when you said I'm Odysseus. I don't have a mind for that. I don't know my way around the politics and the structure of different organizations. And I get pissed off at organizations because I have a simple surgeon brain, and I'm like, just do that. But then there's a subcommittee, and you have to pass a motion here in this paperwork.
Well, I have a great quote.
Yeah.
It's a great quote that I heard. I can't ascribe it to anyone now, but it is great for neurosurgeons. I don't get ulcers, I give ulcers.
Yeah.
And so the reality is that,
Yeah.
look, the ultimate jujitsu, right, is to understand the scenario you're in. Wrath is, to me, it's a sin. It's a sin that allows you to be human. Because to be, you've seen the stories, right, about people who are so upset because their spouse never got upset, right? There's no passion. Passion has that, right?
And I think we've all been in fights where one person, as you say, isn't reacting, and the other person just keeps
escalates
because you're trying to get a reaction.
Yes.
Right?
And that's very human. It's a human fault. It's a human folly. But right now in this culture, people say, you could never do that.
Yeah.
Once you cross this line, you're done, right? And I think that's bad, because it leads to the pent-up rage that creates much more extreme reactions in the back end. But for neurosurgeons, if you're not experiencing wrath on a regular basis internally,
Right.
then there's something wrong.
Well, and that's just where I want to finish this one, because I think the ultimate anger, the ultimate wrath that we are all possessed by, probably the most frequently, I hope, but talk about the least, is anger at ourselves.
Yes.
Right? Because if you're in this world, and I don't mean the world of neurosurgery, I mean if you're in this world, period. If you're living life here as a person with responsibilities, and you aren't disappointed with yourself on a day-to-day basis, then something is wrong with your standards or with what you think is expected of you, because we live in an imperfect world. And man, the times per day that inside I'm just like, you fool, you abject, and it's so common in our neurosurgical training. We all want to be perfectionists, and it is so easy to take that rage, and again, as I conceived of it, as saying, you are my enemy, and to point that accusing finger at ourselves. That can be a good thing, right? You hold a standard for yourself, you want to improve, but it can be so self-destructive if it's not tempered by, like the story you shared of forgiveness for mistakes made.
Well, let's go back to Star Wars and Yoda, right? About fear and anger and resentment, and how that led to a disruption in the Force, right? I don't want to be a Star Wars geek, but it's substantial, because in the role of Anakin Skywalker and Darth Vader, that's how it plays out, right? But I think that you're right. The standards are the key. And if neurosurgeons out there are not feeling some kind of discontent with their situation, then that's not normal.
Right. I often quote something I heard. I did one of my sub-Is at UVA, and when I was there,
Mark Shaffrey, shout out to Mark and Justin and everybody there.
To Mark Shaffrey, whom I'm about to quote, because when I was there, as happens probably every day at every neurosurgery program in the country and in the world, one of the residents had blown up and yelled at somebody because that person was making a mistake and the right thing wasn't happening for the patient, blah, blah, blah. And this was brought up at the grand rounds that morning as a teaching moment. And Dr. Shaffrey, who is a phenomenal administrator, I was really impressed by the way he kind of ran the department there, and not just internally, but with the hospital system. He kind of took it as a teaching moment and he said, okay, you were right. Sure. He was wrong. Sure. You were taking care of the patient. Great. The minute you raise your voice and yell, we're not talking about who is right and wrong. We're not talking about what was happening for the patient. The story is you yelled at that person. That's the story. So this has been, perhaps for me, maybe I'm a mini Achilles here, one of the greatest frustrations of my career as a resident and as a physician is this disproportionate focus on the way something is expressed versus the reality and truth of the situation. Because Dr. Shaffrey was right. That is the culture in our hospitals today, is that if I see someone about to administer the wrong drug, for example, or a toxic dose of a drug, and I say, stop, you fucking idiot, don't do that, I'm going to get hauled before the court.
But you know, there's a Senator Palpatine behind all this.
Yeah.
Which is that paraprofessionals, nurse practitioners, PAs, they want this.
Right.
Because they know it's how to rob power from us. The non-neurosurgeons, they want this because it robs power from us. We just want to get people through our systems safely.
Yeah.
And this is the unwritten undercurrent, which is so insidious. It's crazy.
Yeah. The most powerful words in a hospital in the United States these days are, I'm not comfortable with.
Comfortable with, yes.
Everything stops.
And that is a bunch of bullshit, because I'm not comfortable with people being hurt.
Yeah.
And so once they raise that specter, any janitor can come for us.
Yep.
Now, you and I, we're simpatico on this. We rebel against that. Neurosurgeons are special. We hold ourselves to high standards. With that comes great responsibility, and it's not privilege. The ability to tell people what's right and wrong. Because we live with the consequences. Nobody else will be there. Pre-op, intra-op, peri-op, post-op.
Right.
All these other motherfuckers are gone. It's just us.
And so you're the one to ask, because you are further down the road. You have positions of leadership in multiple hospitals, professional organizations, and you're someone who gets furious.
I get furious.
I
Right
mean,
there, you can see it.
Yeah, I mean, any resident, any junior resident watching right now, you know exactly how many boxes you have to check and how many non-physicians you have to bend the knee in front of to get a patient into an operating room, who have no relationship with the patient, who aren't part of the consent process, who have nothing to do with the surgeon. And even when you call the attending in and the attending says, oh yeah, that's fine, or it's okay, we'll proceed, and someone else says, I'm not comfortable with that, and everything comes to a stop. Sing, O Muse of the Rage of Achilles. Tell us what to do. Tell us what to do with that.
So the reality is, all politics are local. So I'm not saying I won on this, because I could lose any day, but ecosystem control is key.
Yeah.
Proximal ecosystem control. So even Achilles had his myrmidons. Achilles alone, shouting in the wilderness with Patroclus about how he wanted things, one man fighting against the world, is limited. You need to have your ecosystem. And I don't want to go overly into this because it's probably another mini-series, ecosystems of the clinic, of the OR, of the ER, ICU, all that. We can talk about that. It's probably good to bring on representatives from all those environments,
Yeah.
right, to talk further. But the reality is this: we stand alone. That's why it's so difficult. When you are standing alone, I mean, Mark is my good friend, and he's great, but the reality is that those words were not encouraging. Because in the end, there's a human life. And I will say this, and this is going to go down very badly for me, maybe, but I'll say it in context, and please do not anybody take this out of context. The trial attorneys sometimes are our friends because they are a bit of quality control. I'm not saying there's no frivolous lawsuits. I'm saying in the end, when it all comes out that the surgeon did everything that was right and everybody else was doing protocol,
Yeah.
we stand unblemished. But we take all the hits, right? This is the calculus on what we do. So this is a very complex topic. It requires subtlety, nuance, cannot be taken out of context. But the reality is that ecosystem control is the only way we survive, other than knuckling under like Gooby.
I'll tell you what. Pisses me off.
And it should.
Yeah.
So up next is
Greed.
greed. Oh, this is so.
And generosity.
We're gonna go deeper with another alcohol because we're having fun here in Miami. But okay, greed.
All right, coming up next.
Greed it is.